What is up, Spa City? Welcome to the Specific Chiropractic Center's podcast, the Spa City Podcast. I'm your host, Dr. Grant Dennis, featuring all of the community leaders and people doing big things for the community of Hot Springs. Look forward to seeing you guys on the inside. What's up, guys? Welcome back to another rendition this week of the Spa City Podcast, the hottest seat in Spa City, where we feature all of the greatest folks in the community of Hot Springs doing really amazing things for the community. And I'm really stoked about this week's episode because I have New Hope Therapy, Dr. Nicki Sessions. You heard that. I said Dr. Nicki Sessions because she is a doctor of physical therapy. And we're going to jam out a little bit on physical therapy and how she helps her people in the community. Talk a little bit about the difference between chiropractic and physical therapy, our unique specialties. Nicki, appreciate you joining me this week.
Thank you. Glad to be here.
I know you guys have some really cool stuff going on over at New Hope Therapy. You've got a building that's being built right now. I think you said 7,000 square feet of place where people can come in and get hope. I love the word hope. I love your name because we stand for a lot of the same things. But first, I would just want to introduce our viewers to you a little bit. Tell me a little bit about your origin story, where you grew up, why you wanted to become a physical therapist, anything you feel comfortable sharing.
Yeah, absolutely. So I'm from Springdale, Arkansas, born and raised there, and ended up transferring down to UCA to start just diving into where I was going to head. I started pre-med. I ended up getting a back injury that led me into physical therapy specifically. My family has a long history of just medical professions in general. I've got grandfather, uncles, cousins that are chiropractic, and so it seemed as though I was a little bit of the black sheep, but then through the course of all this, we really complemented how our practices are, but then where the strengths in the practices are. So I enjoy being able to work with chiropractors in the community, and I think it gave me another different perspective than some physical therapists. But through my back injury, I was able to rehab and get back to full function, and so I changed directions. Physical therapy became open to have a doctorate program, and I had a friend say, hey, I think what you're wanting to go into in medical is actually more kind of like this. So I dove into it and I loved it, and it's fun. I mean, I don't feel like I work every day. I feel like I get to just help people get better and hang out with them, and so yeah.
It's amazing. And we were talking a little bit before coming on air about how your grandfather was a chiropractor in the Hot Springs community for 35 years?
Yes, Dr. Russ Nelson and his brother, Dr. John Nelson. So they owned a practice down by Oaklawn.
Wow, that's amazing. So your family's been serving the community for a really long time. It's super cool to see you doing the same thing. You kind of alluded to something. One of the things I see a lot just in the healthcare spectrum is I feel like I see a lot of people who end up maybe in physical therapy school who should have been in chiropractic school. And I see a lot of people who end up in chiropractic school that really should have been in physical therapy school. And I think one thing that would really benefit our viewers is for us to kind of talk a little bit about really the difference. I think it's tragic sometimes when people end up in a career maybe they thought would be different, or you talked about how you love what you do. You love going to, it's not even work, right? I love going into the office every day and serving people. And I'm much in the same way because I feel like we both ended up in the right career. And so maybe we've got some people out there who are like, maybe I want to go as a second career to be a physical therapist, or I want to go and be a chiropractor or a massage therapist, or even a personal trainer, right? But in your view, what's kind of the uniqueness that physical therapy can offer to people that really is, what I like to say is within the lane of physical therapy, right? Like what is it that medical professionals, when they send to physical therapists, or as a chiropractor I send to a physical therapist, what is it that really is unique about physical therapy from that standpoint? Because I know you guys do speech therapy, occupational therapy, you do a lot of therapies, but just specifically talking about physical therapy, what is, for you, the physical therapy lane?
Yeah, absolutely. I mean, I think, in working with a lot of the local chiropractors, I typically tell people, hey, we specialize in, the musculoskeletal system. I mean, we are very good at being able to rehabilitate orthopedic injuries, being able to,
maybe even surgeries.
Yeah, I mean, surgeries for sure. Sports agility type situations. We also see pediatrics. And so just the neurodevelopment of that. But I think the place that we have found is that it really bridges the gap is hey, okay, we're able to do this with this child or this adult, but these people in chiropractic are specialized in the spine, they're specialized in the nervous system, like, you know, I mean, you can speak on behalf of what you do as well, but this is where, hey, this could be great if you could see this professional this many times a week, and then us and complement, and then being able to rehab and train the body through neuro re-education of our muscle systems, and take that to a whole other level. Also, at New Hope Therapy, we are heavily focused on just having therapists. We don't have any techs, and so every patient that we see has direct care with a licensed professional, and I think that also allows for us to navigate those situations even healthier, to be able to bridge the gap with other professionals like chiropractic in the city. So,
yeah, well, one of the things that, you know, and you've been a physical therapist for how long?
Since 2011, so about 12 years.
Gotcha, yeah. So, you know, over the last 12 years, I'm sure you've seen a lot of things I've seen over the last 8 or 9 years, which is, I've never really met one individual who needed just one provider.
Yeah.
Oftentimes it takes a village when it comes to taking care of people with the things that we take care, you know, or help people with. So for example, if somebody, you know, a lot of times, you know, a hot low back, right? Like was working in the yard, that's really busy this time of year. It's fall, I'm working out in the yard and I heard a pop in my back. Well, I'm a chiropractor, so people call me. Yeah. They see chiropractic, they call me, and to be honest with you, like that's really not a great fit for me, but because I'm a chiropractor, people call me. I tell them like you're going to be much better suited because of this acute thing you have going on. I'm assuming you want to be out of pain today. You're 8 out of 10 pain. You got pain going down your legs. I tell you what, let me send you over to Nicki and let her take care of you with the things that they're equipped to do, which is your therapies and your acute palliative care type things. And in the same way, like a lot of times chronic things become chronic. People, as they go out of the acute phase, have chronic things that show up. I'm a little more better suited for chronic stuff. So in that way, they still need what you do, but maybe they need a little bit of extra complement, right? I mean, I see that with healthcare, we're kind of evolving in a way now where people need multiple different things. I think that's one of the things that's unique. You know, you mentioned you guys don't have techs. I think that's unique. A lot of people in experience with physical therapy just see a tech. They don't really see a physical therapist, but with speech, with occupational therapy, you guys do a kind of a full gamut of things there. But would you say it's fair to say that a lot of times people need more than just one particular provider? Do you guys see that in your practice a lot?
Oh, absolutely. I think one of the hearts behind New Hope Therapy is creating a network, and that's even our new building is going to say New Hope Therapy Wellness Center. I mean, I want to be able to complement with other professionals in this town. I think when people have met me and learn who I am, they're like, oh wow, she legitimately wants to be able to partner. You know, I don't want to be able to do it all. I want to be able to work with other people that do it all and do it well, because we can only be as skilled as we are within our own scope. And so it just allows for that patient or that person, that child, to have the best experience if we're, you know, covering a whole scope of their needs.
Right, and you had mentioned a new center coming, something I know you're really excited about. You guys have a new center coming over, you said off of Broderick Street, yep, over by the Budweiser plant over there. Now, what's kind of the vision for that? What's exciting? What's the exciting things coming with that?
So it's a 10,000 square foot building that 7,000 of it will be New Hope Therapy's part. We will build out other parts to it for, again, you know, other professionals that complement health and wellness in the community, and then have some other leasable space to just see where God opens the doors for that opportunity. But the exciting thing for me is seeing pediatrics and adults. We were able to research, you know, just what is best for a patient-centered environment. You know, so often you go into places and it's like, hey, I want you to come here for me because this is what's best for me. This is what's convenient for me. But in building a location that grows with the patient according to age, ability, activities of daily living, or being able to go outside in an atrium area that creates advanced terrain, or place-based play that's therapeutically a whole other level than saying, hey, come to this clinic, this is a very sterile environment, especially on the kids side. You know, that's not going to complement what the world is around them, you know. And just on the adult side, being able to make sure that we're meeting their needs beyond just what a normal therapy place is of a gym setting, you know, and taking those people into a different environment, whether it be outside, inside, or whatnot, and having other areas to do that with a sports agility gym, or like I said, going outside. So.
Yeah, I love that. Well, I mean, you know, as far as maybe for our viewers, what is really kind of your mission, kind of your vision for New Hope? You've kind of alluded to it a little bit, but what is really just at its core for our viewers? What is kind of the overarching mission and vision of New Hope?
Absolutely. You know, Hope, our mission is to create positive hope for this community, and that steers from just the scripture, Hebrews 6:19. It's close to my heart from family experiences and making sure that we're steadfast in health and wellness and allowing for who we are to create that path of hope, whether it be through rehabilitation or creating more range of motion. I mean, the little things matter a lot in physical therapy. It's
absolutely.
like, hey, going to the bathroom, or, I can't reach to get, I don't know, the mayonnaise out of the fridge,
Yeah, a lot of things.
So hope is different for everybody, but just taking our skill set and what God's blessed us with and then making sure we try and spread that.
Yeah, I love that. I love that. It's very cool. I think that's one of the reasons why, like when people come in our office, Mark 16:18 is the first thing they see, totally resonate with that. Maybe for you personally, what is maybe like, for me anyways, there's always like that avatar or that person that like, this is who I do my best work with, right? Like, obviously maybe that's a broad stroke answer, but maybe just on a concise fashion, like what is maybe just the person that, not like the person in like by name, but like what is the individual that really just you enjoy doing your best work with? I know that's a loaded question. Just about like condition wise, or
okay, like a style of like a patient.
Yeah,
scenario.
yeah.
Well, me personally, I don't know. I kind of like the complex patients.
Okay.
you know, so the patient that says, "Hey, I've tried this everywhere," and I'm like, let's see what we haven't figured out.
Right.
For me personally, I enjoy things that don't make sense, that aren't cookie cutter. I love neuro a lot. I think that's why I also love partnering with professionals like chiropractic, because there's such a neuro component to what y'all do. I think our bodies are just so very unique that sometimes we get very systematic in what we do and we lose sight in kind of thinking outside of the box, and again, for New Hope Therapy, bridging the gap between adults to peds, I mean, once I have treated pediatrics, it's like, man, if I would have been doing this with some of my, neuro patients who have had strokes or TBIs, then I could have, taken this situation to a whole other level. And I think bridging the gap in that. So probably that situation, I'm a very manual therapist, so I like a lot of hands-on. Again, that's why we don't have a lot of tech, opportunities in our practice. And I don't know if that answers your question.
No, it did.
Not.
It totally did. And I think, I want to go back to peds here in just a second. I don't want to lose sight of that because I think that's an important component to this. But I think it's really important. A lot of times, and I'm sure you guys get this a lot too, sometimes people, I find, just want to know where they need to be. So when they call your office or they call my office as portal, primary portal of entry, they don't, do they need a referral to actually come and see you, or can they just come in because you're at DPT? They can just, they don't need a referral, correct?
Yes.
Yeah. So because we're both primary portal of entry, so for the folks at home, what that means is you don't need a referral to come to New Hope or come to the specific. You can just, anybody can walk in through the door and anyone can call us.
Except for Medicaid, I will say, on the pediatric side.
Sure, yep. And so when it comes to, sometimes people call and they just want to know because they trust you and I, where do I need to be? Hey, I've got this issue. I'm just trying to figure out where I need to be. In the world of, I'm careful with this, but sales, everyone's trying to sell something, right? So because you call, hey, what do we have to do to sell you to get through our door? I think that's one of the things that really sets you and I apart, is we're looking for who do you need to be there for. And I call it kind of playing the quarterback a little bit. Would you say that's fair to say in your practice? A lot of times people call and part of your job is to figure out like maybe you don't even need to be here. Maybe you need to be somewhere else. Do you guys run into that a little bit?
Oh yeah, 100%. And I think that's where kind of the scope of physical therapy kind of grew in the last probably 10 years. Was just like, hey, we are systematic exercising people, and that's our specialty, to, hey, we need to be able to differentiate our diagnosis. Like, when do you refer out? When do you know that, hey, this is beyond your scope? Like, let's go ahead and partner with these people. Like, how do we get the best care by, resourcing other professionals in the community,
Yeah, and I know that we've talked before about how what we're seeing now in the community is a larger and larger and larger incidence of pediatric populations with neurodevelopmental disorders.
Absolutely.
So, looking at autism and looking at pandas and PANS and neurodeflective disorders and some of these, and there's a lot of controversy and a lot of things out there about what's causing this continued spike in that, right? Some say it's tech, some say it's kids on iPhones and iPads, some, there's a lot of theories for that, right? But what are maybe some of the things with these incidences of higher and higher pediatric populations? What is kind of some of the things you guys are seeing and doing for these types of cases? I know you guys are doing a lot of amazing things with this area.
Yeah, I mean, I think one of the nice things is having a full scope of PTOT speech, and some mental health components as well. But I will say that we, again, liking to be outside of the box, there's some really incredible opportunities to study in the parts of our body of our reflexes and how our nervous system, develops from a very primary primitive state, and then how we're able to kind of repatternize our nervous system in a way that it receives information well. And in doing that, it's called, we use a technique called MNRI, and so it helps in re-regulating the nervous system. And in doing that, then instead of taking a closed mouth that's not able to receive, hey, I need to be able to walk, now suddenly you're patternizing something as a Babinski or a foot tendon guard that was natural to the body anyways. They were doing it in utero, to now, hey, we're going to go ahead and we're going to teach the body how to redo that, and then suddenly they are able to motor plan how to do that better. And it makes it easier on us because it's not a strength thing, it's not something that you can't just hammer out more exercises to. You've got to retrain that nervous system or alleviate pressure on the spine, or in complement with kind of like me talking to you the other a few weeks ago about making sure that alignment is correct, making sure that our nervous system is receiving the patterns and the pathways that it needs to.
I think it's a complementive, so like you had just alluded to, I mean, we can, as far as our scope of our work goes, is much like you guys, we believe the body's designed to heal. It's looking for a particular stimulus that it needs or wants. Our job is to locate a misalignment of atlas that's causing pressure on the neural system that is underlying unbeknownst to them. Well, if that's there, then it's really sometimes hard to maybe get that pediatric patient to where they need to be. And vice versa for us. We remove the underlying thing that we're looking for if we don't have the complementative retraining pathways. You said MNRI. I've never heard of that. I want to know more about that. Those types of things that then allow for that type of therapy to be exponentially important for them.
Absolutely.
It's kind of a complementary approach. I think that's one thing that, for a long time anyways, and is that physical therapy and chiropractic were kind of looked at this synonymous, like they were looked at as the same. And I think it's such a travesty that, and especially our viewership, understand how different the two fields are and how they truly complement one another. I think one of the things that as a physical therapist would really frustrate me is seeing chiropractors doing physical therapy. Much like in the same way that physical therapists probably get really irritated, or the chiropractor get really irritated when physical therapists want to do chiropractic. And I think it's really important viewership understands they are two separate, distinct fields that are doing two completely different things. I know it's got to be something, like if I was a physical therapist, it would frustrate me. But I think our viewers need to understand is that they really are truly have always been meant to complement one another. The analyses are different, the type of interventions are different, but they both are there and exist to help somebody who, like you said, is suffering from something that they need outside the box thinking. Especially in today's medical system. I know, we look at the medical system nowadays, it's very, you use the word cookie cutter. And I agree with that. I think it's very much, I think that's where people get frustrated and are seeking out new ways of looking at things outside the box. Without maybe naming a particular, or maybe without stating a particular case, what's maybe some of the more innovative things that are coming out of New Hope when it comes to results? What are some of the things you guys maybe are seeing the most incredible things with currently, you'd say?
Absolutely. Like I said, I think we take pride on the pediatric side in being very neuro-driven and being able to kind of go beyond the scope of what typical, like therapists would probably normally do, and in doing that and taking time to figure out, okay, where's the baseline with this patient? Like, here's the goal, I got to hammer out the goal. It's like making sure that you understand your patient's needs from a very deep level, and then that allows for you to get far beyond the amount of goals that achieved than you would prior to that. And then on the adult side, I definitely feel as though just being able to again, bridge the gap between that pediatric side and the adult side. I think having a team of incredible therapists that you can bounce ideas around to, is a strong point for us, specifically. But also being able to take that patient and say, hey, I think the neuro side is a very important part of what we do, being one-on-one somebody can walk into New Hope Therapy and tell me something's different, and I mean, I don't have to have them then come to me another day to change the plan of care. I mean, we're able to address their needs immediately that day, you know, and I think that's an important part of how we can take that different. You know, we've been able to see, you know, certain cases. I've got one gentleman that I was able to work with specifically that, you know, he's like, man, you are so much harder. And I'm like, I'm not near as hard as what's outside those doors. You know, I'm like, I promise you. And he's like, you push me more, you make my prosthetic, you know, gentleman, like push me more. And I'm going, no, we don't have it. We don't have it. This is more. And I think being able to do that, being one-on-one with us, allows for us to kind of bridge that gap, or say, hey, today we're not reaching this. So in this assessment, let's refer out to this, you know, let's go ahead and jump on top of that instead of 3 weeks later, you know, you're suddenly doing it when you've lost some traction or some momentum, you know?
Yeah. You know, I think a lot of times too, I get this a lot when I talk about, you know, checking pediatric population. They're like, well, why would a pediatric, you know, child, adolescent, young teen, young adult be checked by a chiropractor? Like, what? Well, there's a lot of value behind a clear functioning adapting nervous system in development.
Yes.
I think sometimes people too also maybe say the same thing about physical therapy. I mean, where they say, well, isn't that for rehabbing a knee, or isn't that for chronic degenerative disc, or well, why would you? What can physical therapy possibly do for a 6-year-old, right? So you know, if there was, has there been any, you know, I think a lot of times parents, they're like, you know, my kid or my child has, my kid's not the right word, my child has neurodevelopmental delay. Like, the first instinct probably is not to say, hey, let's go see if physical therapy is the answer, right? They're going to go and to a psychiatric doctor or a neurologist, something like that. Like, what have you found is kind of the way that they enter into your world, and how are you guys able to say, hey, there's a lot of value in what we do, and here's why?
Yeah. So, I mean, a lot of times I think there's a misinterpretation that specifically in PT we just exercise people, you know, and it's like, no, we don't just exercise, you know. That's probably, honestly, in the grand scheme of things, that's probably the least thing that we do. Like, we are doing neuro re-education, we're doing activities of daily living. I mean, there's tons of things, gait training. I mean, like, tons of manual techniques that we're trying to do with stretching and myofascial and, you know, things that realistically, that's what we do. You know, the exercise is probably a small part, more towards the end of it, that we're achieving because we've done all these other things, you know. And then just the carryover, and research supports so strongly about gross motor, and then the ability of that to carry over to our oral motor control, and being able to see that the growth in the language, and you know, and so the complementing parts to the speech pathology parts, you know, like, they've really learned that in where the parts in our brain are, you know, we need to complement language with movement, you know, sensory processing, being able to hit those heavy weights, the feedback that the body's needing to be able to, you know, modulate yourself and not become, you know, just very disorganized in how you're able to regulate, you know. So the complementing parts to each of them are very important, but then independently, it is very important to make sure that people understand that we're not just exercising, or we're not just teaching how to walk. I can't just teach somebody how to walk. Like, I've got to retrain the body in how to receive that, how to appropriately go into the right, you know, forefoot motion and all that type of stuff.
I just learned something there. You guys, as we just exercise people, is like we just crack people.
Yeah, you just crack people's spine, right?
That's that's like the nails on a chalkboard for me, is when I tell, like, I get to the point, I don't know if you probably don't run into this as much, but when I meet people and they're like, what do you do? The last thing I tell them is that I'm a chiropractor, because then what I get immediately following is, will you crack me? Like, you cracking backs, you know, and it's like, it's like if you come to a chiropractor, much like if you come to a physical therapist to be exercised. I tell people, it's like if you just go into a chiropractor to have your back cracked, it's like buying a Lexus because it has air conditioning. Like,
that's great.
Okay, well, there's so much more features to what is available in that Lexus, much like with physical therapy, like the exercising, right? Well, if you just want to be exercised, it's not a knock, but like, there's great personal trainers who can teach you to exercise. The issue is they cannot teach you because they're not trained to do the neurodevelopmental, the neuro-stimulating the pathways, teaching them the neurodeflective things that your nervous system is asking for, to retrain it to do those pattern movements. I think that's one thing that our viewers could massively benefit from is, I mean, a lot of times it's looking at what is the particular specialty or analysis that I need for my particular situation. So let's just take like a role play here. We've got a 9-year-old who has neurodeflective disorder. So maybe it's a girl who has maybe even a form of Asperger's or a form of autism, or what some would say a sensory processing disorder or social type of anxiety. And so they would say, well, why the heck would I take them to an upper cervical chiropractor and a physical therapist? They can't possibly do anything. And I think that's a big misconception. And of course, the things that you and I see, it's like, well, that's our passion. That's what we do our best work with. How do we educate a parent to know that? And I think a lot of times it's as simple as, you know, if that child had an upper neck trauma during the birthing process that caused the atlas vertebra to misalign, occluding blood flow, CSF flow, and neural development is being slowed down through the frontal lobe, that's an underlying problem. Now, because of that, we also have another underlying problem where we have the pathways that are supposed to be being fired during development not happening. So it could be as simple as us locating that vertebra and aligning it properly. And I think that's the first key, is that we're checking to make sure that that's there. We're not assuming it's there. That's the first big one, is I'm not assuming you need to be checked or need to be adjusted. We're going to check. Then outside of that, they could be perfectly fine, but then they need what you have to offer. Or maybe they need to be adjusted and also what you have to offer, which is, you know, through the retraining of the neural pathways and where your expertise lies, that certainly doesn't lie with me. So if you're a parent out there and you're going, well, you know, because we're seeing higher and higher incidences of this. I mean, 1 in 4 boys are being diagnosed with autism now. I mean, it's crazy.
It is.
And these neurodeflective disorders, and that's why I'm just so thankful for places like New Hope, where you guys are like, look, we're bucking the trend outside of just rehabbing knee, you know, what's the word I'm looking for? Knee replacements. Where, you know, hip. I think that's the stereotype, much like in chiropractic. It's only for low back pain. And I just super appreciate what you guys are doing with kind of looking at things outside the box, looking at things at a different lens. Maybe just in closing, you know, what is something that, and I know you guys have how many employees?
We've got 40 employees, so
you guys are a big
therapists.
operation. I mean, you guys have a lot of people. You know, I'm assuming you guys are seeing with all of these different, which is what's causing a $7,000 or 7,000 foot, much more than $7,000, 7,000 foot expansion. You know, obviously you guys are growing at an incredible rate. What is maybe one of the things that you guys are most excited about going into this next phase? I mean, is it 80 employees? Is it? I mean, are you guys looking to get more employees? Like, what's kind of the is it just the space satisfied to the people you have now? It sounds like you guys are kind of cramped in the space you are. I mean, that's a good problem to have. You guys are outgrowing. What's kind of the thing you're most excited about in the next phase of New Hope?
I think I'm most excited about being able to work more with other opportunities in this town of where we want to grow and do. I mean, we are on top of each other. Anybody that comes in, they can see our waiting room is just busting at the seams because it's small. I mean, you know, and so, you know, we will probably add a few therapists here and there, but really we were growing to just be more appropriate for what the patient needed anyways. And so being able to have the room to do that is going to be incredible. There's a lot of incredible places around this town that do things similar to what we do in a very great way. And it takes all of us, you know, it does take a village. And so I think I'm most excited to be able to have opportunities like this and learn about other professionals that are like, hey, I would love to work together and complement our treatment styles and what we do and respect each other in our scopes and what we do. I love being able to find new opportunities like that. So I appreciate you.
What's the Sessions clan doing on a weekend in Hot Springs? Let's say you guys have a weekend off. One of the things I talk a lot about on this podcast is how fortunate we are to be in the city of Hot Springs, that we work here, we live here, we get to serve this community, and it's truly fun to be a tourist in your own hometown. What's kind of the go-to, if we're going to find the Sessions clan on a weekend, like currently in this phase of life, what is you guys' kind of favorite things to do in town?
Well, in times past, we've always gone camping. We love to get outdoors. If it's on the fly, we love to hit the Greenway. I mean, we're bike riders, you know, just outdoors a lot. You know, we're hitting baseball fields or whatever else. Love Majestic. We're over there probably 4 nights a week.
It's nice now. So
that
helps.
It is. It's really nice. Definitely hit up some good ice cream shops, you know, so we got to do that. And
because you have kids, correct?
Yes.
2?
We've got 3
kids. That's
so
right.
10, 8, and 6. So we're busy right now in this season. So
10, 8, and 6. So
we're running.
You guys are running and gunning. Well, listen, I super appreciate you popping in today and sharing with us. I look forward to the people in the community of Hot Springs hearing a little bit more about your vision for New Hope, and I super appreciate you being on with us this week.
Thank you.
Folks, that's going to wrap us up this week. Appreciate you joining in. And when it comes to the neuropediatric population, listen, you need to, hopefully you've gathered some valuable nuggets on if you've got children who are suffering from some of these things we talked about, that potentially the Specific Chiropractic Center and potentially New Hope there could be a good collaboration for you, or maybe one or the other. And maybe you picked up some nuggets today on some of the things you can do as a next step. Look forward to seeing you guys next week on the Spa City Podcast. Until then, we will see you. Go out and explore our city, and we'll see you next week. Thanks for joining us this week, guys, on another episode of the Spa City Podcast. And remember to subscribe to everywhere you listen to podcasts, Spotify, Stitcher, Apple Podcasts, YouTube, and check us out on social media. And remember to support all of our community members we have on this podcast and everybody who's doing big things in the community of Hot Springs. And until next time, see you.